About 70% of women will be diagnosed with fibroids in their lifetime. For Black women, it's about 80%.
Hey everyone, welcome to today's bonus episode. This is the first in a series of bonus episodes where we will speak with a fertility expert about a specific subject. The idea is to give you a baseline understanding of the issues that people face when trying to conceive. We're going to be rolling these out throughout the year, and our hope is to keep these episodes short, concise, and extremely useful, so you can download the information you need, or you can pass it along to a friend. If there's a specific topic you'd like us to talk to a physician about, just let us know. You can reach out on Instagram at This Is Infertility Podcast, or you can shoot us an email at thisisinfertility@progyny.com. Progyny is spelled Progyny. Today we're going to learn about uterine fibroids. I'm Dan Bolger with Progyny, and this is Infertility. Today's guest is Dr. Desiree McCarthy-Keith. She's medical director of Shady Grove Fertility in Atlanta, and Shady Grove is often called SGF. Okay, let's dive in. So what are uterine fibroids?
Uterine fibroids are non-cancerous smooth muscle growth that develop in the uterus, and they can distort the uterus. They can give women symptoms of painful menstrual cycles, irregular bleeding, pelvic pain, pain with intercourse, and they can also be a cause of infertility.
Those are significant symptoms, and we'll cover the treatment options, some of which are quite invasive. And of course, we established right off the bat that 70% of women and 80% of Black women have fibroids. That's all pretty scary when presented like that, but of course, there's some serious good news as well. The biggest good news about fibroids is that while most women have them, sometimes they don't cause any issues whatsoever and require zero intervention.
It can be very stressful for women to go in for, an annual checkup and are feeling well, or they're going for a pregnancy ultrasound or just an ultrasound for another reason, and a fibroid is identified. And just having that diagnosis sometimes makes women concerned that do they have to manage the fibroid or have surgery for it? And it doesn't necessarily mean that there's anything that has to be done. If a woman is completely asymptomatic, then she can just monitor those every 6 months or once a year with her GYN.
If you or a friend are diagnosed with fibroids, it doesn't necessarily mean much of anything. Fibroids in and of themselves are not dangerous. But when there are symptoms, especially very uncomfortable symptoms or symptoms that prevent pregnancy, then intervention can be helpful. And with fibroids, just like real estate, it's all about location. Well, location and size.
Fibroids that are within the uterine cavity can block an embryo from having a healthy place to implant. So those are the fibroids that we really focus on, fertility specialists. If they're what we call submucosal, which means that they're distorting the surface of the uterus on the inside, those are ones that we really want to remove or address so that women have a better chance of getting pregnant. We also know that fibroids can develop and grow once a woman is pregnant. And if fibroids become larger, they can also irritate the uterus. They can lead to preterm contractions. They can be a risk factor for miscarriage of an early pregnancy. And they can also cause early deliveries later in a pregnancy.
So naturally, the question is, for fibroids that impact fertility, what's the treatment?
Surgical removal of fibroids is called a myomectomy. And myomectomies can be performed through several different routes. They can be performed hysteroscopically, which means passing a small camera through the cervix and removing fibroids from the inside of the cavity. That type of procedure is done as an outpatient and doesn't require any incisions on the abdomen. There's also an abdominal myomectomy, which means making an incision on the abdomen, entering the abdomen and removing fibroids by cutting from the outside of the uterus and removing fibroids in that way. And the type of procedure that's performed is determined by the size, again, and the location of the fibroids. The hysteroscopy has a much shorter downtime since it's an outpatient procedure and there are no incisions on the abdomen. That procedure usually takes about 30 minutes in the operating room. Patients go home the same day. They might have mild cramping or light bleeding for a few days afterwards, and they're back to their normal routine pretty quickly. And women can try to get pregnant about a month after a hysteroscopic myomectomy.
Major surgical risks include things like bleeding, general anesthesia, risk to other internal organs, and potential scar tissue in the pelvic area, which can cause further fertility issues. Surgery is never a joke, and these risks need to be discussed with your physician. And as you can imagine, the recovery time for this kind of procedure is significant.
Women are usually in the hospital for 1 to 3 days after an abdominal myomectomy, depending on if it's performed robotically or in a standard open procedure. And then after the myomectomy, women will usually be out of their normal routine for somewhere from 3 to 6 weeks. It's also important to understand that once we cut into the uterus to remove fibroids in that way, we don't want women to ever go into labor and have strong contractions of that portion of the uterus. And so women, after having an abdominal myomectomy, are counseled that they will need a C-section for any pregnancies in the future. Additionally, they would need to wait longer after that procedure. So like I mentioned, after hysteroscopy, you can try to get pregnant after about a month. If you have an abdominal myomectomy, we recommend waiting at least 3 to 6 months after that procedure so that the uterine incisions have time to heal before a woman gets pregnant and her uterus starts to expand and stretch on those areas that have been cut and then sewn back together.
There's a big difference between the two techniques that Dr. McCarthy-Keith just laid out. That's why when major surgery is recommended for fibroids, it's probably a smart idea to go get a second opinion. It's not about finding the doctor who will tell you what you want to hear, but it's about making sure you truly understand your options.
Second opinions are always good, especially when you're talking about going for an invasive procedure. You want to make sure that you're comfortable with the recommendations that are being made, and it's never a problem. I'm never offended by a patient who wants to get a second or a third opinion. I think that that's helpful and healthy in their decision making. And so I encourage that.
Another important thing to note about fibroid removal is that even after they've been removed, there's no guarantee they won't grow back.
What's very difficult is that we have no way to predict whose fibroids will return or who, we've all seen many women who've had one myomectomy and they never have another fibroid and their uterus looks great. And we've seen women who have a myomectomy and within a couple of months of that surgery, we're starting to see fibroids develop again. So what we try to do from a fertility perspective is kind of get in the middle of giving the uterus time to heal from that procedure, but not waiting so long that fibroids have a longer time to recur. And that's how we get to the recommendation for about 3 to 6 months before trying to get pregnant. It's a short enough window that fibroids should not be able to return and grow to a significant degree, but it gives time for the uterus to heal so that it's safe for a woman to be pregnant.
As we stated, fibroids are extremely common. 70% of women have them, and even more common in Black women as 80% of Black women have them. And it's not just that Black women are more likely to have fibroids. The fibroids in Black women tend to behave a little differently than others.
For Black women, the fibroids are more likely to develop at a younger age. They're more likely to be multiple and larger. And we are more likely to undergo surgical procedures, whether it's myomectomy or hysterectomy, for our fibroids compared to other ethnic groups. And what's very interesting is that when studies look at the progression of fibroids, usually fibroids are stimulated by hormone production. So the greatest time to see activity from fibroids is when a woman is in her reproductive years. And then as we get close to menopause, hormone levels start to decrease, and fibroids usually do not grow beyond that point, and they start to shrink a little bit. But what we've seen for Black women is that you don't see that leveling off of the fibroids, where in other ethnic groups, as you get into the 40s, the fibroids don't grow as much. For Black women, we continue to see an increase in the size and the symptoms related to the fibroids, even when they're starting to level off in other ethnic groups.
This is a fertility podcast, so we're focusing on that, but it's good to be comprehensive. There is another surgical treatment for painful fibroids.
If fibroids develop in a woman who has completed her childbearing, she has no plans for future pregnancy, and she's having symptoms from her fibroids, then she is likely a candidate for a definitive treatment like a hysterectomy to remove the uterus, including the fibroids, so that they can't recur and her symptoms are improved.
And I hope it goes without saying that if hysterectomy is suggested, a second and third opinion are certainly called for. So that's 3 different surgical options for symptomatic fibroids. There are also non-surgical paths for some. We're mentioning them last here because most of these options aren't always considered safe for someone who's trying to conceive.
We have to be careful about those from a fertility perspective. So there's a radiology procedure called a uterine artery embolization. It's an alternative to surgery where an interventional radiologist can insert pellets through the large blood vessels in the groin that lead up to the uterine arteries, which are the largest source of blood flow to the uterus, which will block off the uterine arteries, and there's still collateral blood flow that gets to the uterus from other other blood vessels and channels. So you're not taking all the blood flow away, but you're taking a significant portion of the blood flow away. And when you do that, you're kind of starving the fibroids a little bit. So fibroids will shrink. Fertility specialists usually do not recommend the uterine artery embolization because in taking blood flow away from the fibroids, you may also be taking blood flow away from the rest of the uterus. And while some women can get pregnant and have healthy pregnancies after a UAE, some women may have some permanent effects from the UAE that make it harder to get pregnant or can increase their risk of pregnancy complications. And that is a permanent procedure. So we don't recommend the UAE for women who want to preserve their uterus for pregnancy. Medicines can also be used. Pain medications, non-steroidal, anti-inflammatory medications may help with that. Birth control pills and hormones can be used to just regulate cycles and help with the bleeding also. There's another hormone that we use occasionally called Lupron, which is an injection that will suppress the ovaries from producing estrogen. And when the estrogen drops, fibroids usually shrink. Lupron is not a medication that can be used long-term because you don't want to go with low estrogen for too long, or it kind of puts you into a menopausal state.
Now, what about diet or some sort of super supplement? Is there a way to just lifestyle fibroids away?
I hear that so often, and I've had many patients who have come to me and they've, adopted a vegan diet or vegetarian and removed certain things from their diet to see if they can reduce their fibroids. I don't know of any particular diet that's fibroid reducing or dramatically nutritionally how we can shrink the fibroids. We just don't have that information at this point.
So that's uterine fibroids. They can mean basically nothing, or they can result in a difficult journey. We think the takeaway here is that knowledge is power. Understanding what fibroids are and how they can have an impact is an important first step. Then you can talk to your physician about your specific case and understand the recommended treatment at a higher level. And when needed, go get that second and third opinion. I want to give a big thank you to Dr. McCarthy-Keith from Shady Grove Fertility for taking the time to educate us today. If there's a specific topic you'd like us to chat with a physician about, just let us know. You can reach out on Instagram at This Is Infertility Podcast, or you can shoot us an email at thisisinfertility@progyny.com. As I said at the top, Progyny is spelled Progyny. This Is Infertility is brought to you by Progyny, Smarter Fertility Benefits. Please remember, this podcast is not intended to substitute for the personalized expert advice of your physician. I'm Dan Bolger, and this is Infertility.